sheet friction-free as he's coming across, because this is a muscle test. This is not Goni, where you can help and take him up a little tiny bit and guide him through. It's not a guide, and I'm definitely resisting him at the same time. I swear, I'm just pushing him. No, you want us to understand that you get the concept. Okay, so let's pretend right here that it is friction-free. I am on that side. All right. I'd ask him to bring. Let's say we're testing his left leg. I'd ask him to bring his left leg to the side. Go ahead, all the way. And you see how he almost wants to externally rotate a little bit? Once he starts doing that, that's all the range he has. Okay? So, at the end, we can give him a little end feel. All right? See if that's all he's got. That would be a test of what? If he was gravity minimized, doing this, and he got it all the way across. 2 or 4, right? So, if I wanted to give him a little bit of resistance, what I would do, this is where a lot of you guys are going to screw up, it's not resistance down here. You're at a big mechanical advantage if you're down here at the foot. There's no way, if you're testing for 2+ and hold him here, bring your leg out to the side, that he can ever win. We can hang out here all day. Alright? He's really trying, guys. Alright? So again, stabilize. Okay, you are just proximal to the knee. Realize again, it's gravity minimized. It's not a 4 or a 5. My hand's not like this. Show me that you understand fingertip. Yes, you get it out in the real world. You might be like this, and you know what your resistance is. My hands don't go through yours. I can't feel what you're showing. You have to demonstrate that you understand the theory. All right? Now, everybody understand that? If we're looking for trace, what muscle does this? Gluteus medius. How do we know where gluteus medius is? Right. So if you were looking for trace, find greater trochanter, put a finger or two on greater trochanter. Can you do me a favor? Can you try to bring your leg to the side? It's not moving, but you might feel a palpable contraction in your hand, which might be huge. You tell the patient, keep trying, keep trying, keep trying, keep trying. All right? Don't be like, sorry, man, you're screwed. There's no hold for you. Oh, man. Okay? So if we're looking for adduction, guys, this is another key. All right? We're going to ask the patient to bring his leg. If you get it on the practical, this is what I want you to show me. Ask the patient to bring his leg to the side. All right? Because you're showing me that you look to see if he has active range of motion. Why is it important? Because you have to start this test in 25 degrees of abduction. Because adduction comes closer to the body, right? Aliens abduct you away from your body. That's just the way I learned it. All right. So we've already assumed that he has the motion. So now we can put him in about 25 degrees of abduction. Make sure that he's in that line, all right? I don't want to have any side bending. I don't want him to start coming off the table and going like this and getting a side bend another way, all right? Once we've decided that we know for sure he's got that motion, ask him to bring his leg back. Again, friction-free surface. Come to the practical prepared. You have your sheet, all right? You're going to come with powder, right? Okay? Now just have a sheet. Show us. Bring your leg back in. All right? Now, if you're looking to see if a person has trace, you want to feel for adductor longus, adductor magnus. All right? We've talked, many, many times about how to find these things. So palpate. I want you to tell me a little more than regional here. This is more you actually telling me how you derived and got there. All right? Now, if you want to do a 2+, 4+, again, proximal to the knee. Again, I would be on that side. I am on this side for the purpose of demonstrating, so you guys can see. Is that clear? Okay. Now, if I was looking to do against gravity, hip abduction, have him lie on his unaffected side. All right? Just like with hip extension, get him in a good position. Make sure he's not paying attention to what you're doing. Support his neck, or tell me you would support his neck. I don't really care about his neck right now. Thanks. Bottom leg bent to 90. All right? Make sure that he's not going to have any rotation. All right? I'm going to ask him, all right, and watch how much extension there is in the spine. All right? He's a little too far anterior here. This is a big shear. All right? That's better. Okay? And I'm going to ask him to bring his leg up to the ceiling. Okay? One thing you're going to see with your patients, you're going to see this. Or you're going to see them doing some bit a little more anterior. All right? Very rarely will you see this. All right? People have a little bit of a weak extensors. It's an arabesque exercise. Most people won't be doing that. If they're able to go up, it's a what? 3. And then go from there with your 3+, proximal to the knee, 4 and a 5. Please show me that you understand that you are above the knee joint. All right? Now, for the purpose of this, you guys are here. Let's just say for adduction, we're testing his bottom leg. So again, this time, the affected leg is down. Who here works at an outpatient office? All right. Who here is seeing 4 ways for knee? Right. And this is the hardest one for a lot of patients. It's very uncomfortable. Some people don't have good flexibility. Just keep an eye on that. Make sure that the other knee doesn't have pathology. All right. But the way Bill wants you guys to learn it is the other foot is flat. All right. I know a lot of places they'll show you like this. The other foot comes up a little bit more. Foot is flat for the purpose of this. Again, watch the spine. Ask him to keep his leg pointing straight ahead. Bring it up in the air. All right. Go ahead again. You see how weak he is there? It's not him. A lot of people are. All right. See all that shaking? It's a little muscle wasting, a little muscle weakness. Again, just proximal to the knee. Everybody got those two? Not so bad. All right. We are probably going to ask you, if you get a 3+, a 4, or a 5, where would you test trace? Make sure that you remember to tell us gravity minimized. All right? On your back again. All right. Everybody understand? Good so far? Questions? Don't feel embarrassed to ask a question. Now's the time. If you have a question, look at him. Ask him the question.
For the compensation for that was, I think I saw his ankle either everting or inverting.
Exactly.
Like both times.
You don't want any inversion or eversion.
Okay.
Exactly. He's weak. That's why he was doing it. He was turning it out.
So that would be a compensation.
That would be a compensation. Okay. You want it to be pure. All right. Think about the ankle pointing straight. All right. It is a little bit of a harder motion. It is probably one of the the hardest ones to keep pure. But you'd say that. So most people probably would have a compensation. Okay. Next two, internal external rotation. All right. Gravity minimized. We're going to say it's right side so you guys can see this. Again, biggest thing. You're nervous. Okay. Remember what external and internal are. Remember the difference. Okay? Now, you want to make sure that you're stabilizing. All right? Get the hip at about 90 degrees. All right? Stabilize that hip. All right? If you are looking for external rotation, he's bringing his foot in. If you are looking for internal rotation, bringing the foot out. All right? Does that make sense? All right? If you're looking for a 2, trace, whatever it is, remember, you are not giving any resistance. You're kind of just supporting. This leg is going to want to fall. You have to support. I like to give a little force straight down because it kind of just keeps it supported. You like to do anything different?
No, just make sure you're not coming, make sure he's staying neutral, like this is right there, 90 degrees of hip flexion, and he's neutral to AB and adduction, right? You don't want it to be adducted, abducted, flexed, extended. You want it right in that 90-degree angle.
Can everybody see that, guys? I'm not this way. Like Dr. Norman said, I'm not falling in. I'm not higher than 90. Okay? I'm not letting him fall out like this when he's doing the test. I'm not getting nervous and only looking right here. I'm looking at the entire patient. I'm realizing that this is a position that a lot of people get tight. All right? So I'm going to ask him, do me a favor, can you bring your toe out towards me? Okay? And that's that. See where my thumb is? I can give it 2+. All right? So that would be what? A measurement of what? Internal rotation. All right? If I wanted to look at external rotation, what can I do? Bring his toe in. All right? And again, that's where he wants to, that's his end range. All right? And he starts to drop. In order to get more, he starts dropping down and going into abduction. Okay? So really, like Dr. Norman said last week, after you do that full test, make sure you check for the end range. We're going a little quicker now, assuming that you guys understand that you're supposed to do end range, supposed to do all that. Make sure you're doing the same thing we've taught you all along.
So how do you palpate external rotation in that position?
How do you palpate for like a trace?
Yes.
All right. What are you going to look for if you're doing internal rotation?
Glute medius.
Gluteus medius. All right. So from right here, extra palpable contraction, gluteus medius. I think Bill says he's fine with glute max for external rotation. All right. Pigo and GoIQ a little harder to find. General palpation, it's more of an aerial thing. Glute max. All right. You could tell me what else you'd expect to do it. All right. Because I'm going to ask you to tell me that, and I'm not. Trust me, I'm probably not going to say give me origin, insertion, innervation of glute max. That's being exceptionally nice. All right. Probably going to ask you to pick one of the other ones like pure form or something and give me that stuff. Okay. That makes sense. All right. So the key here for all of these is watching internal external rotation on ab and ad, and we're watching that there's no ab or ad when you're looking for internal external, because that will be the compensation. Does that make sense? All right. Against gravity, he'd be sitting up over the side of the table. We'd have a towel underneath his leg. Anybody got a towel? You came so prepared. 5 extra points for you.
Everybody has a towel today, right?
Yeah. Mm-hmm.
Because I know we had this conversation on Tuesday.
Because I know it's really silly, but to start losing 5 points.
Jenny, could you just scooch over me that way a little bit? Yeah. Just because you're, yeah, thank you.
To start losing points for professionalism is silly because a lot of you guys are going to struggle with some classes, and you don't want that to be the reason that you retake a year at PT school. All right, so bend this leg back. All right, I'd be right in front. All right, if I'm looking for external rotation, I'm sorry, which way would he go? In. Okay, if I'm looking for external rotation, which way would he come? All right, and again, you're going to watch for compensations in the spine. He's sitting upright. Or I'm in front of him right now, guys. Understand? This is just you guys being able to see. I'm watching to make sure that he doesn't ab or adduct again, right? He stays on his plinth. I stabilize. Now, again, this is one of the only motions where you're actually, it's a hip motion, right? But where's my resistance? It's
Ankle.
2 joints below, okay? Because we're deriving it through here, okay? These are not incredibly strong muscles. This isn't like knee extensors. So my pressure for a 4 and a 5 is not going to be my typical pushing super hard, okay? Cross-sectional area, these are not that strong. So you don't have to go crazy on them. You gotta show me that you understand that, all right? If you test on the other side, we know it's not that strong. You don't have to come in with a ton of force. Does that make sense? All right? So again, here, you're going to show me 3+. You're going to show me 3+, 4 and a 5, and you know it's a 4 or a 5 by comparing to the other side. So on your practical, you're going to compare it to the other side unless someone says stop. Not so bad, right? All right, let's go practice those.